Well, EchoIQ is an AI technology company that is looking to solve the problem in cardiovascular disease. Right now, cardiovascular disease is the number one killer in the world, worldwide, regardless of a geographical location. And so what we're trying to do is simply help a physician or a cardiologist diagnose structural heart disease better than they currently do today. And an example of that is for a disease such as aortic stenosis, where 15 to 20% of patients today will go mis or underdiagnosed. Our technology helps a cardiologist to diagnose those patients more accurately and faster, and hopefully getting them into the quality of care that they need. With EchoIQ, over the last 12 months, we've had an incredible amount of success, starting from October of 2024, where we had our first FDA clearance of our solution for aortic stenosis. That led to a launching of the product in January of 2025, which also happens to coincide with me starting off as CEO of the company, where we've had a tremendous amount of success launching the product, commercializing the product, and actually integrating in a number of hospitals. So a couple of things that are really important, I think, for folks to know about EchoIQ in the last several months. We've been able to integrate into a number of hospitals, including a flagship hospital, Beth Israel, which is part of the Harvard Medical School. We've been able to integrate with a number of our scientific partners, which would be SARC Medic and SciImage, which constitutes a very large number of hospitals that we have opportunity to integrate with. And probably most importantly, if there's some investors out there looking at EchoIQ, we've just finished a capital raise where we've been able to secure $17 million, which is now allowing us to be very well funded, have a great balance sheet, and to focus now on pure commercialization. One of the things we're excited about for the future is the fact that we've got our heart failure product, which we've announced to the public, where we've finished our pre-sub with the FDA, and we've announced a partnership with the Mayo Clinic, who will be doing our validation study going forward. And we're hoping to have approval for the heart failure solution by the end of the year. So you can see we've had a tremendous amount of success in the early parts of this year, and nothing more but exciting opportunities coming for the future. Well, the interesting thing about the area that we're focusing on is obviously cardiovascular disease, as I said earlier, is still the number one cause of death worldwide. And what we're seeing is that this is starting to increase across the world simply for a couple of factors. One, we know there's aging population. The other, we know that there are a number of comorbidities that are affecting heart disease, whether that's hypertension, whether that's obesity. One of the statistics that always just bothers me is that in the United States, about 50% of our kids, unfortunately, are either overweight or obese, which tells us that we have a long ways to go in trying to tackle cardiovascular disease. So one of the things that we're really interested in here with aortic stenosis, this is a very large market. And as I said earlier, 15 to 20% of patients, unfortunately, are being mis or underdiagnosed. So when you think about the market, not only the size of the market, and it's growing at about 8%, the fact that the number of these patients are being missed tells us that this market is only going to expand as solutions such as EchoSolve AS for aortic stenosis is going to help find these patients and get them into treatment and care. Now, that's one solution. We also know that structural heart disease is continuing to see evolution. So things such as heart failure, which is our second solution coming to the market, has got tremendous opportunity. This is a very complex disease to diagnose. And unfortunately, about 50% of those patients go mis or underdiagnosed every day. And if we can have an opportunity to close that gap, our current technology shows we're getting about 97% of those patients accurately diagnosed. That tells us that that's going to increase these markets. So as you look at cardiovascular disease as a whole, tremendously large market. If you look at structural heart disease, you can see the growth and the opportunity for us to find more patients, for these patients to get the access to care they need, is going to be a tremendous opportunity for us in the future. Well, we're really excited about the opportunities we have, not only for the solutions we currently have that we're working directly with the FDA or that are cleared, but we're looking at our pipeline as an opportunity to continue to work with our partner NEDA, which is the National Echo Database of Australia, to be able to continue to do research looking at other structural heart diseases such as mitral valve regurgitation, pulmonary hypertension, that are going to be other disease areas that we have opportunities to look into. But what I'm really passionate about the future of our technology is the ability for us to start taking some of that biases that happen within the current clinicians' offices around women. And it's not there's a cardiologist ever in the world that's saying we don't want to diagnose women. But if you look at the actual number of people who are mis or underdiagnosed, it's disproportionately females. And our technology has been able to demonstrate in the early parts of our clinical data that we're actually able to close that gap and actually diagnose women at the same rate as men, which says that we're going to have a huge opportunity here in the future to really address women in cardiovascular disease. And that's something I'm very passionate about. I think if we can actually bring a technology to the market that eliminates that unconscious bias, gets those women diagnosed, and every one of us has a loved one, whether it's a mother, a grandmother, an aunt, or even a significant other as a partner, knowing that they would have the opportunity to get that same diagnosis as a man going forward to be something incredibly important. So what if you were to ask me what I'm most excited about, it's that opportunity we have to continue to build that clinical data around women and cardiovascular disease. And of course, to continue to look at our pipeline. So when we look at AI, this is where I envision AI having a real big impact on healthcare.